talk to you about poisoning. Poisoning, one must know, can be intentional or accidental. Poisoning can happen by toxic substances that are usually present in the house, or may happen with the regular day-to-day substances we use in additional dose than the recommended dose. Now, poisoning can happen from various areas in the body. It can happen by contamination with the skin and absorption of the toxic substances through the skin. It can happen by ingestion of toxic substances through the lungs and through the mucosa. It can happen most commonly by the oral ingestion of poisonous substances. And one needs to understand how, if and whether a patient has, or a victim or your family member has probably consumed any toxic substance, is probably under the influence of a poison. Number one, you can identify it by burns which are probably present around the lips and oral mucosa and on the tongue. You can see burns on the skin which can say that there is probably a toxic exposure to the skin. Patient can be drowsy, patient can have altered mental status and can be confused and talk irrelevant stuff, which probably indicates that they have taken an overdose of any medication. People can be unconscious, that can indicate that the patient probably has taken a poison and is under and has a poisoning. Now, this poisoning can mimic various clinical conditions and at times can be confusing. So one thing, as in a pre-hospital setting, which I would encourage, is to check for pills, empty bottles of consumed tablets, maybe an acid, especially with children in the house. They can consume acid, they can drink shampoo, they can drink detergent, and that can lead to poisoning. Empty kerosene bottles, probably petrol. So check for any empty cans or empty pills of strips or empty bottles around you. That can help the doctor, when you shift the patient to the hospital, understand what kind of poisoning has been taken and what is the antidote that can be given. Number two, which probably goes on, do not induce vomiting until and unless you are very clear as to what type of poisoning has happened. Wash the skin thoroughly if there is skin exposure under running water for 15 to 20 minutes and shift the patient to the hospital as early as possible.